Pancreatitis. Definition. Pancreatitis happens when pancreas becomes irritated and inflamed, swollen. It's not a common condition. There are multiple causes, but the main culprits are gallstones or heavy alcohol use. Pancreatitis is an inflammation, swelling, of the pancreas. When the pancreas is inflamed, the powerful digestive enzymes it makes can damage its own tissue. The inflamed pancreas can cause release of inflammatory cells and toxins that may harm lungs, kidneys and heart. Types of pancreatitis. Acute pancreatitis is sudden inflammation that lasts a short time. It can range from mild discomfort to a severe, life-threatening illness. Most people with acute pancreatitis recover completely after getting the right treatment. In severe cases, acute pancreatitis can cause bleeding, serious tissue damage, infection, and cysts. Severe pancreatitis can also harm other vital organs such as the heart, lungs, and kidneys. Chronic pancreatitis is long-lasting inflammation. It most often happens after an episode of acute pancreatitis. Another top cause is drinking lots of alcohol for a long period of time. Damage to pancreas from heavy alcohol use may not cause symptoms for many years, but then client may suddenly have severe pancreatitis symptoms. Risk factors. The major risk factors for pancreatitis are excessive alcohol intake and gallstones. Although the definition for excessive alcohol intake can vary from person to person, most healthcare professionals suggest that moderate consumption is no more than 2 alcoholic beverages a day for men and 1 a day for women and the elderly. Other risk factors include a family history of pancreatitis, high levels of fat, triglycerides, in the blood, cigarette smoking, certain inherited disorders such as cystic fibrosis and taking certain medicines, for example estrogen therapy, diuretics and tetracycline. Causes. Gallstones and long-term alcohol abuse are the main causes of pancreatitis. Other causes include use of medications such as valproic acid and estrogen, viral infections such as mumps and Epstein-Barr virus, a very high blood triglyceride level or a high blood calcium level, cystic fibrosis, or being a carrier of a gene that causes cystic fibrosis, inherited defects that result in early activation of digestive enzymes, pancreatic cancer, certain autoimmune conditions, injury, trauma, to the pancreas. Pancreatitis can cluster in some families and there are several known genes that contribute to increased risk for pancreatitis. Some cases of acute and chronic pancreatitis have no clear cause. Pathophysiology. Symptoms. Acute pancreatitis. Common signs and symptoms of acute pancreatitis include severe upper abdominal pain that may radiate to the back and often increases after eating or lying flat. The pain is sometimes referred to as epigastric because it occurs in the upper middle part of the abdomen. Nausea, vomiting, fever, rapid pulse, abdominal swelling and tenderness. These attacks cause local inflammation, swelling, and hemorrhage in the pancreas that usually go away with appropriate treatment and do little or no permanent damage. Sometimes, however, acute pancreatitis attacks are severe and complications can develop, such as tissue death, necrosis, pancreatic pseudocysts, sacs filled with fluid and dead tissue that can become infected, infection, low blood pressure, which can lead to shock, difficulty breathing, kidney failure, chronic pancreatitis. Pain with chronic pancreatitis may be severe and continuous or intermittent. It may be made worse with eating or drinking, especially drinking alcohol. Over time, as more of the pancreas becomes scarred, the cells that produce digestive enzymes are destroyed. This can cause pancreatic insufficiency, unintended weight loss, malnutrition, the buildup of fluid in the abdomen, ascites. Pancreatic pseudocysts, sacs of fluid and destroyed tissue that can become infected. Greasy, foul-smelling, fatty stools. As the cells that produce insulin are destroyed, client may develop diabetes. Diagnosis and test. History taking, complete medical and surgical, dietary history, alcohol abuse, smoking, occupation, family history. Physical examination, head-to-toe examination, abdominal tenderness, abdominal pain. Blood tests. A healthcare professional may take a blood sample from client and send the sample to a lab to test for high amylase and lipase levels, digestive enzymes made in pancreas. High levels of blood fats, called lipids. Signs of infection or inflammation of the bile ducts, pancreas, gallbladder, or liver. High blood glucose, also called blood sugar. Pancreatic cancer. Stool tests. The doctor may test a stool sample to find out if a person has fat malabsorption. Ultrasound. Ultrasound uses a device called a transducer, which bounces safe, painless sound waves of organs to create a picture of their structure. Ultrasound can find gallstones. Computed tomography, CT, scan. CT scan creates pictures of pancreas, gallbladder and bile ducts. CT scans can show pancreatitis or pancreatic cancer. Magnetic resonance cholangiopancreatography, MRCP. MRCP uses a magnetic resonance imaging, MRI, machine, which creates pictures of organs and soft tissues without X-rays. Doctor or a specialist may use MRCP to look at pancreas, gallbladder, and bile ducts for causes of pancreatitis. Endoscopic ultrasound. EUS doctor inserts an endoscope, a thin, flexible tube down throat, through stomach, and into small intestine. The doctor turns on an ultrasound attachment to create pictures of pancreas and bile ducts. Doctor may send client to a gastroenterologist to perform this test. Pancreatic function test, PFT. The doctor may use this test to measure how pancreas responds to secretin, a hormone made by the small intestine. Management. Collaborative care. Objective of collaborative care for acute pancreatitis include relief of pain, prevention or alleviation of shock, reduction of pancreatic secretions, control of fluid and electrolyte imbalances, prevention or treatment of infections, removal of the precipitating cause, conservative therapy, focused on supportive care, pain management, form morphine, antispasmodic, correction of hypovolemia using normal saline and colloids, use NG suction to reduce vomiting and gastric distension, decreased stimulation of pancreas, avoidance of alcohol, keep patient in NPO. Mild acute pancreatitis usually goes away in a few days with rest and treatment. If pancreatitis is more severe, treatment may also include pharmacological therapy, morphine relief of pain, nitroglycerin or papaverine, relaxation of smooth muscles and relief of pain, antispasmodic, dicyclomine, propenthyline bromide, decreased of vagal stimulation, motility, pancreatic outflow, carbonic anhydrase inhibitor, acetazolamide, reduction in volume and bicarbonate concentration of pancreatic secretions, antacids, neutralizations of gastric hydrochloride, histamine, H2, receptor antagonists, ranitidine, proton pump inhibitors, omeprazole, decrease in HCl and stimulates pancreatic secretion, calcium, if hypocalcemia tetany occur, prophylactic broad-spectrum antibiotic, pancreatic enzyme replacement, nutritional management, diet, low in fat and high in protein and carbohydrates, small frequent feeding, pancreatic enzyme supplementation with meals, correct malabsorption of the fat-soluble vitamins A, D, E, K, and vitamin B12. Medium-chain triglycerides in patients with severe fat malabsorption, they are directly absorbed by the small intestine without the need for digestion. Surgical therapy. Done in case of abscess, severe peritonitis, acute pseudocyst. Percutaneous drainage of pseudocyst. Choledochodunostomy. Common bile duct is anastomosed into the jejunum, where it diverts bile around the ampulla of water. Endoscopic cholangiopancreatography. ERCP. Doctors use ERCP to treat both acute and chronic pancreatitis. ERCP combines upper gastrointestinal endoscopy and X-rays to treat narrowing or blockage of bile or pancreatic duct. The gastroenterologist may use ERCP to remove gallstones blocking the bile or pancreatic ducts. Nursing management. The patient who is admitted to the hospital with a diagnosis of pancreatitis is acutely ill and needs expert nursing care. Nursing assessment. Assessment of current nutritional status and increased metabolic requirements. Assessment of respiratory status. Assessment of fluid and electrolyte status. Assessment of sources of fluid and electrolyte loss. Assessment of abdomen for ascites. Diagnosis. Acute pain related to edema, distension of the pancreas, and peritoneal irritation. Imbalanced nutrition, less than body requirements related to inadequate dietary intake, impaired pancreatic secretions, and increased nutritional needs. Ineffective breathing pattern related to splinting from severe pain, pulmonary infiltrates, pleural effusion, and atelectasis. Planning and goals. Relief of pain and discomfort. Improvement in nutritional status. Improvement in respiratory function. Improvement in fluid and electrolyte status. Nursing interventions. Relieve pain and discomfort. The current recommendation for pain management in this population is parenteral opioids including morphine, hydromorphone, or fentanyl via patient-controlled analgesia or bolus. Improve breathing pattern. The nurse maintains the patient in a semi-Fowler's position and encourages frequent position changes. Improve nutritional status. The patient receives a diet high in carbohydrates and low in fats and proteins between acute attacks. Maintain skin integrity. The nurse carries out wound care as prescribed and takes precautions to protect intact skin from contact with drainage. Evaluation. Relieved pain and discomfort. Improved nutritional status. Improved respiratory function. Improved fluid and electrolyte status. Pancreatitis complications. Pancreatitis can cause serious complications, including pseudocyst. Acute pancreatitis can cause fluid and debris to collect in cyst-like pockets in pancreas. A large pseudocyst that ruptures can cause complications such as internal bleeding and infection. Infection. Acute pancreatitis can make pancreas vulnerable to bacteria and infection. Pancreatic infections are serious and require intensive treatment, such as surgery to remove the infected tissue. Kidney failure. Acute pancreatitis may cause kidney failure, which can be treated with dialysis if the kidney failure is severe and persistent. Breathing problems. Acute pancreatitis can cause chemical changes in body that affect lung function, causing the level of oxygen in blood to fall to dangerously low levels. Diabetes. Damage to insulin-producing cells in pancreas from chronic pancreatitis can lead to diabetes, a disease that affects the way body uses blood sugar. Malnutrition. Both acute and chronic pancreatitis can cause pancreas to produce fewer of the enzymes that are needed to break down and process nutrients from the food eaten. This can lead to malnutrition, diarrhea and weight loss, even though client may be eating the same foods or the same amount of food. Pancreatic cancer. Long-standing inflammation in pancreas caused by chronic pancreatitis is a risk factor for developing pancreatic cancer. Prevention of pancreatitis. The following recommendations may help to prevent further attacks or to keep them mild. Completely eliminate alcohol because it is the only way to reduce the chance of further attacks in cases of pancreatitis caused by alcohol use, to prevent pancreatitis from worsening, and to prevent the development of complications that can be very serious or even fatal. Eat small frequent meals. If in the process of having an attack, avoid solid foods for several days to give the pancreas a chance to recover. Eat a balanced diet high in carbohydrates and low in fats because may help individuals decrease the risk for pancreatitis since it is likely these actions will decrease the risk for gallstones, a major risk factor for pancreatitis. If pancreatitis is due to chemical exposure or medications, the source of the exposure will need to be found and stopped, and the medication will need to be discontinued. Don't smoke. Maintain a healthy weight. Exercise regularly.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.